In recent times, tension between India and Pakistan have escalated. While both nations are nuclear armed, the thought of a nuclear war isn't just a political nightmare, it's a human disaster on an unimaginable scale. But what actually happens to the people when an atomic bomb is dropped? What diseases, what sufferings, what horror awaits for survivors? In this video, we explore the terrifying medical consequences of nuclear warfare, not just for these two nations, but for the entire planet. So first of all, the immediate impacts. When a nuclear bomb detonates, the impact is immediate and brutal. Cities vanish, millions dies in seconds. But for the survivors, that's when the real suffering begins. Thermal radiation causes severe burns, often down to the bone. Blast pressure shatter buildings and bodies. Radiation exposure starts attacking the body on a cellular level. Survivor in the blast radius may experience severe pain, blindness, and bleeding, but that's just the beginning of the medical nightmare. One of the deadliest after effect is acute radiation syndrome or ARS. This happens when the body absorbs a high dose of radiation in a short time. Early symptoms are nausea, vomiting, diarrhea, and later symptoms are hair loss, internal bleeding, and infection. In severe cases, death can occur within days to weeks. There is no cure, only supportive care. Years after the blast, survivor faces a hidden enemy, that is cancer. Radiation mutates DNA and triggering deadly diseases later in life, like leukemia often appears within 2 to 5 years. Other cancer like thyroid cancer, breast cancer, lung cancer, and skin cancer. Children are especially vulnerable, and the risk lasts a lifetime. Radiation doesn't stop with one generation. Pregnant women exposed to nuclear fallout often give birth to babies with severe birth defects, missing limbs, deformed organs, and intellectual disabilities. And the worst part, these genetic changes can be passed down to the future generation. Survivors may suffer from other radiation-related diseases like cataract, clouding of the eyes, hypothyroidism due to radioactive iodine, chronic lung disease from inhaling fallout dust, and as healthcare system collapse, other diseases spread rapidly like cholera, dysentery, typhoid fever, tuberculosis, and COVID-like respiratory infections. But the consequences wouldn't stop at borders. A nuclear war between India and Pakistan could inject millions of tons of smoke into the atmosphere, blocking sunlight for years. This caused global cooling, crop failures, mass starvation, famine-driven diseases outbreaks. Even countries not involved in the war could suffer from food shortage and climate chaos. We are talking about a global humanitarian crisis. Amid all this, the mental health toll is devastating. Survivors develop post-traumatic stress disorder, severe anxiety, and depression. Families torn apart, cities gone, hope erased. The invisible wound may never heal. This is not science fiction. This is what happened in Hiroshima and Nagasaki. And with the destructive power of today's weapon, the outcome would be far worse. So before we talk for war, we must understand its cause, not in politics but in human lives, in pain, in disease, in generalization, suffering. Say no to nuclear war. Choose diplomacy, choose peace. Like, share, and subscribe for more critical global insight.